our channel. In today's video, we will discuss about a polychrist, deep acting and a strong poison which is obtained from unripened capsules of poppy plant. Yes, we are talking about opium. So our today's medicine is opium. So in this video, we will discuss about what are the special. We have also provided a very beautiful mnemonic for remembering opium and also the mental generals. So let's start our today's video. So common name of opium is poppy plant. It was discovered by Sir Christian Frederick Samuel Hahnemann and it belongs to Pepperaceae family. This opium contains at least 20 different alkaloids such as morphine, apomorphine, codeine and narcotine. Dr. Hahnemann says that opium is almost the only medicine that in its primary action doesn't produce a single pain. Opium is a long-acting. As you can see here on the screen, we have provided a picture of different potencies which are made by opium plant after potentization. You can see here different potencies like 30Ch, 200Ch and 6X. Now as you can see here on the screen, we have made a very beautiful mnemonic for you guys for remembering opium permanently in your mind. So let us discuss about this beautiful mnemonic. So opium. O stands for old, wrinkled, skin like old man. P stands for patient, complain nothing, want nothing and painlessness. I stands for involuntary black stew. U stands for urine, which is retained, and unquenchable thirst for cold water. And last M stands for move often in search of a cool place. So this was all about the mnemonic. I hope you guys will like this and will remember this beautiful mnemonic we have provided for you guys for remembering opium for permanently in your mind. So this was all about the mnemonic. Now next we will discuss about mental generals of opium patient. We have also provided a drug picture theme of opium. You can see here on the screen. And the most PQRS symptom of opium patient is that patient complains nothing and wants nothing. Now let us discuss about the mind symptoms of patient of opium. So opium is a great remedy for distinct and characteristic mental symptoms like the patient complains of nothing and want nothing. They tells you they are not sick, though they has passed no stool or urine. They has a temperature of 105 to 116 degree. There is a confusion of mind, delirium with great stupor. In delirium, the patient is constantly talking, especially when aroused. Their face looks besotted, red puffed, eyes glassy and half closed, with loud snoring. The patient thinks that they are not at home, which is continuously in their mind. During sleep, picking of bedclothes is marked feature. Bed feels so hot they cannot lie on it. Moves often in search of a cold place. It is often the topmost medicine for complaints originating from fright. When fear or the idea of fear remains or the cause of it comes before the eyes, there is also a sensation of bodily bulbing and great happiness, great sensibility to sound, light and faintest odors. So this was all about mind of opium patient. These are the mental generals of opium. Now next we will talk about a very basic topic of this video, that is, what are the 10 special centers of sphere of action of opium on human body. So we'll discuss about them one by one. So the first special center of sphere of action of opium is on cerebrospinal nervous system, or you can say the human brain. Now let us discuss about this. In small doses, as from a quarter of a grain to 1 grain, opium to sleep, which gradually steals over the senses and at last wraps the mind in unconsciousness. There is a repose of the body, undisturbed by the pain or external annoyance. In larger doses, as from 1 to 3 grains of opium, produces much more decided effects. The stage of excitement is much more strongly marked. The head feels full, hot, and sometimes light. Buzzing noises are in the ears. The face and the eyes are injected. While the pupil is more or less contracted, flashes of the light are apt to appear before the eyes. The ideas are confused, and sometimes there is a delirium. The pulse is fuller. Generally, there is nausea and some cases vomiting. In these symptoms, depression succeeds. The pulse beats more slowly and often irregularly. Now, what is narcotism? So, poisonous doses of opium produce effects like those just enumerated, except that they are much more decided. According to Dr. Bick, he said the following symptoms are usually observed with a short time, that is giddiness, insensibility and immobility, respiration scarcely perceptible, and a small feeble pulse. According to Dr. Jones, he concluded that opium causes sleep, in part at least, by its action on the vasomotor nerves, produces a contraction of the cerebral arteries, the supply of the blood being diminished, the functions of the hemispheres are for a time in abeyance. The opposite phenomenon is produced by belladonna and stramonium. They dilate the arterial capillary vessels, enhance the congestion, and maniac delirium will be produced. And after that, from the poisoning by the opium, the convulsions of the brain are found to be flattened. The vessels of the cerebrospinal axis and its investing membranes are gorged with black blood. In the capillaries of the brain gives out on incision minute drops of the same fluid. A serous lipid is usually met with in the ventricles of the brain and under the cerebral face of arachnoid membrane. The lungs, the heart, liver and spleen are in most cases distended with dark and fluid blood. So this is how opium acts upon cerebrospinal nervous system, that is human brain. Now the next center of sphere of action of opium is on respiratory system. So let's talk about it. So death occurs from opium is the great majority of cases by failure of the respiration, and that such failure is due to direct action of the poison upon the respiratory centers in the medulla. It is proven by the fact that morphine affects the breathing of the dogs and rabbits whose pneumogastrics have been cut as much as it does. On this account, the blood which returns from the lungs to the heart has undergone a very partial revival but yet continues to circulate. Every moment, however, the proportion of oxygenated blood in the circulatory masses grows less and less until it reaches a point of impurity which deprives its power of stimulating the organs to perform their vital acts, and death soon takes place. So this is how opium acts upon the respiratory centers on the respiratory system. Now next center of sphere of action of opium is on ocular system, or you can say human eyes. So let's discuss about it. So the action of the opium upon the pupils is not fully settled, but according to Dr. Wood, he says, since morphine locally applied doesn't affect the pupils, it follows that its constitutional actions upon the latter is through the nerve centers. The contractions of the pupil is due to the stimulation of the oculomotor nerve centers, and that the dilatation of the pupils as death approaches is due to the paralysis of the same. The condition of the pupils in case of the poisoning is an important prognostic sign. The greater the contraction of the pupils, the more grave is the poisoning. If they are contracted to the size of a pin's head, we may regard the case as one of the great danger, and if smaller, death is certain to follow. So this is how opium acts upon the eyes. Now next, how opium acts upon CVS, that is cardiovascular system and circulation. So let us discuss about it. So the influence of the morphine upon the heart is seen when poisonous doses are given, and consist in animal also in initial acceleration of the cardiac contractions, which is succeeded by diminished frequency of the pulsations, and ultimately by absolute cessation of the cardiac actions. The contractions become irregular shortly before death. The cause of the initial acceleration of the cardiac actions has not yet been sufficiently elucidated with the experiments, but it seems very probable from the researches that the muscular motor element in the heart are first stimulated by the morphine, for when he had divided the vagus of a dog and rabbit before poisoning with morphine, the frequency of the pulsations increased still more after the poisoning. With large doses of the morphine, however, the extremities of the vagus become paralyzed. Consequently, with very large doses of the morphine, the pulse ought eventually to become again more frequent. But it is not so. For this reason, Dr. Galician had shown that morphine exerts eventually a paralyzing action also on other portions of the heart, especially on the excitomotor ganglionic cells in it. But the cardiac muscles also experience a considerable loss of excitability. So this is how opium acts upon CVS, that is cardiovascular system. Now next center, that is a special center of sphere of action, is Vasomotor System. Now let us discuss about it. So morphine exercises first a constriction, then a dilatation, influence on the vessels through the vasomotor nerves, which are primarily excited and subsequently paralyzed at the centers. In severe poisoning, complete paralysis of the vasomotor centers takes place, but not complete paralysis of the peripheral vasomotor nerves, for these can still be stimulated by direct irritation or from the cervical marrow. The blood pressure is in accordance with this condition of the heart and its vessels. So this is how opium acts upon vasomotor system. Now the next special center of sphere of action of opium is on digestive organs and system. So let us discuss about it. So the influence of the occasional use of the opium upon the appetite is very striking. It almost entirely destroys the cravings of hunger, and when it disposed to sleep and during its narcotic influences, it inspires dyspnea, however, seems to annul this effect. The stomach becomes tolerant of the stimulus and learns to perform its functions and considerable regularity. But when the useful quality of the drug is much diminished, then indigestion comes on. So this is how opium acts upon the digestive organs and digestive system. Opium eaters, morphia appears in the urine not longer than 7 days after the cessation of the habit. Opium upon the secretion of the urine and find from their observation that it is more. So this is how opium acts upon the urinary system and the kidneys. Now the next special centers of sphere of action of the opium is on mucous membranes. So let us discuss about it. So the secretion of the mucus from the gastrointestinal canal and the respiratory organs is greatly diminished by the action of the opium and morphine. This wonderful dryness of all the mucous membrane is deglutition, and a dry, hawky voice with tormenting dry, paroxysmal, spasmodic cough. And in the bowels, this dryness is shown by the obstinate constipation. So this is how opium acts upon the mucous membrane. Now the next special center of sphere of action of the opium is on sexual organs, that is of male and female. Now first of all, we'll talk about the male organs. So how it affects the male organs. Now next on the female organs, opium increases the menstrual discharge and brings on irregularities. In excessive qualities, it tends to suspend the menstrual functions. Opium possesses the power of relaxing the circular fibers, at least of the os, and of stimulating the longitudinal and oblique fibers into active contractions. So this is how opium acts upon the sexual organs. Now our last sphere of action, that is a special center of sphere of action of opium, is on the skin. So let us discuss about it. So opium acts prominently upon the sweat glands and the skin. Nothing is better established than the power of opium to excite perspiration. This property of the opium was well known to the older writers. According to Bonetus, he says, "We have hardly an diaphoretic so faithful, so certain, or which so well deserves the name. It has been said that when the salt of morphia are employed hypodermically, the perspiration breaks out first in the neighborhood of the parts in which the inoculation is made, and then extends to the entire surface. Morphine has also produced an exanthem resembling scarlatina. It produces a vascular eruptions, and also a yellow copper colored skin is a marked effect of continued use of the opium. So this is how opium acts upon the skin and the sebaceous glands. So this was all about the 10 special centers of sphere of action. Now next, as you can see here on the screen, we have provided a picture that is clinical aspects. Now here we will discuss about in which conditions you can apply opium. So opium can be used in case of apoplexy, in case of brain affections, in colic, in constipation, in epilepsy, in fear effects of and in marasmus, paralysis, sleeplessness and sleepiness, sunstroke, typhoid fever, and also in the urinary complaints. So this is the clinical aspect where we can use this wonderful medicine, that is opium, or you can say poppy. So this was all about, in this video we have discussed about 10 special centers of sphere of action of opium on human body, and we have also discussed about a very beautiful mnemonic which we have made for you guys to remember this medicine for permanently. And after that we have discussed about mental generals of patient of opium, and after that we have discussed about its clinical aspect, in which cases you can apply opium for sure. So that's all for today. See you guys in our next video. Till then, stay connected with us for more videos like this. Don't forget to subscribe and comment below. Stay safe, stay healthy, and stay tension free. Exercise at least for 1 hour and also meditate daily. And yes, thanks for watching our video.